going to introduce about GIT, gram-negative broths. We are Lee Seoyoung and Lee Ho-yeon. This is our contents. Escherichia coli is a gram-negative bacterium. It has a thin peptidoglycan layer and an extracellular membrane as well as an epithelial membrane. Instead of not making endogenous spores, the shape of the cell changes depending on the state of the nutrients. These nearly spherical cells can survive for a relatively long time, even in environments with little nutrition. Common symptoms of E. coli infection include vomiting, nausea, abdominal pain, diarrhea, and headache. E. coli infection is diagnosed by performing culture tests of urine, blood, and feces. E. coli infection is treated by supplying electrolytes and moisture through oral or vein. Most E. coli infections require no special treatment. However, in the case of severe intestinal pathogenic infant diarrhea, severe intestinal hygroscopic E. coli, and traveler's diarrhea, E. coli infection can spread to others through diarrhea. In order to prevent such transmission, care should be paid to the excrement management of diarrhea patients. In particular, newborns born by diarrhea mothers should be isolated from other newborns and observed for digestive symptoms such as diarrhea. Mothers infected with E. coli must wash their hands and locate in sterile conditions. Salmonella is a gram-negative, flagellated, and common anaerobic liver bacterium containing three important antigens: H or flagellum antigen, O or somatic antigen, and VI antigen. The cell envelope also includes a complex lipopolysaccharide structure that is released when cells are dissolved. Salmonella is a prime example of intracellular bacteria. Therefore, it can be found in various phagocytes and non-phagocytes in the human body. Successful intestinal aggregation organisms enter intestinal cells, M cells, and dendritic cells in the intestinal epithelium. Species and serotypes in Salmonella cause two distinct syndromes. Spleen-typoid Salmonella is a common cause of cannibalictic gastroenteritis in the community. Spleen-typoid Salmonella is caused by ingestion of contaminated food or water, or sometimes contact with an infected person. Symptoms of convulsive abdominal pain, fever, nausea, vomiting, and headache are mainly expressed 6 to 72 hours after bacterial infection. Diarrhea can last for several days and cause dehydration. In rare cases, it can progress to invasive Salmonella infection with urine, blood, bones, joints, brains, and central nervous system. Infants who are at risk of severe diarrhea, severe disease, or complications, or those aged 65 or older or immunocompromised, are given antibiotics. You should eat safe food by washing your hands properly and cooking hygienically. To this end, after going to the bathroom, taking care of infants and toddlers who use diapers before cooking and after handling dirty clothes or linen. In general, Campylobacter species are spiral-curved, rod-shaped, but sometimes they show various forms such as S-shaped. The shape of this bacteria is observed in the infected tissue of the clinical sample, and most of them are observed in the form of a comma when observed, and in the culture stage it is observed in a spiral shape. The bacteria are about 0.5 to 5 micro in length and 0.2 to 0.5 micro in width. Most food poisoning-related diseases are caused by Campylobacter jejuni. The main cause of Campylobacter infection is the take of intake of insufficient chicken and pork. It can also be infected by ingestion of contaminated food, contaminated water, and raw milk extracted from cows containing bacteria from other carriers. Dogs and kittens can also be infected, but it is rare to be infected from human to human. At first, fever, headache, muscle pain, and general weakness appear for 12 to 48 hours. Severe abdominal pain and diarrhea occur after initial symptoms and sometimes accompanied by nausea and vomiting. In particular, if the immune system is poor, there is a high risk of infection and recurrence, severe symptoms, and a high possibility of becoming a chronic carrier. Fecal samples are taken and tested, and severe diarrhea is at risk of causing serious health problems due to dehydration. Treatment is performed through oral or vein. Most Campylobacter infections improved on their own, so antibiotic treatment is not good unless there are other diseases.
The next one is Shigella. Shigella is gram-staining negative rod-shaped bacteria genus. No motility, no spores, no capsules, no lactose. It is the most common intestinal disease in children and causes dysentery in humans, but it does not infect mammals. Symptoms start within a day or two after contact with bacteria, and symptoms of diarrhea, gastric pain, and stomach cramps, fever, nausea, and vomiting may appear. Complications may include disease of dehydration, seizure, rectal progress, and hemorrhagic uremic syndrome. Let me tell you about the cause. First, direct contact can lead to infection. Changing diapers of a baby infected with Shigella and not washing hands are the most common methods of spreading disease. Second, if you eat food that an infected person touches, you will be infected. Third, it is infected by the water that has been swam by the sewage or infected person. The method of diagnosing dysentery can be taken from the stool and examined for appearance or toxicity of dysentery in the pathologist's room. Dysentery is accompanied by diarrhea and blood. Since dysentery is at risk of dehydration, it should be actively treated from the beginning. Antibiotics and administration or intravenous injections can also be given, but antidiarrheal drugs are prohibited when nursing. Dysentery can reproduce better and increase toxins, which can make the patient's condition worse. The first precaution is to be careful of water and food and improve hygiene. Second, if you come into contact with a patient with bacterial dysentery, you should undergo a bacterial test immediately. Third, you should not cook food or take care of your baby until it is confirmed negative. A species belonging to Yersinia that is gram-negative. It's common anaerobic, and some of the bacteria in this genus are pathogenic to humans. Symptoms include bleeding stools due to fever, stomachache, and diarrhea. When pain in the right lower abdomen and an increase in white blood cells are accumulated, it is clinically different to distinguish it from appendicitis. Symptoms are related to active arthritis in 1 to 3 weeks. If sepsis and sepsis are weakened, the cause is infected from pets or through food eat flesh such as slaughterhouses and pigs is contaminated. It is also infected by consumer non-sterilized milk or dry products or contaminated water. Infection is diagnosed through post-tests from blood, feces, phlegm, or lymph nodes. To prevent this, wash your hands thoroughly with soap and water at all times and cook the meat at the recommended temperature. In addition, only pasteurized dairy products should be consumed and pet waste should be treated in a hygiene way. The treatment focuses on relieving diarrhea. Usually it gets better on its own, but antibiotics are needed if the infection has spread to the bloodstream or other organs. Helicobacter is curved or spiral bacteria. It has a multipolar flagella showing fast and spiral motility. Gastritis is specific to humans and produces urease with micro-oxygen bacteria. Symptoms may include acute gastritis, chronic gastritis, gastric and duodenal ulcers, gastric cancer, and gastric lymphoma. Let me tell you about the cause. First, there is a human-to-human infection route, anus-to-mouth pathway, and oral-to-oral pathway. In the case of the anus-to-mouth pathway, Helicobacter pylori release into the feces causes infection in the human stomach through other mediums. Oral-to-oral pathway is not common, but it can also be infected through kissing. The second cause is family infection. If you live with an infected person for a long time, the infection rate of your children is high. In addition, it is infected through gastric secretions and poorly disinfected medical devices. Helicobacter is divided into non-invasive and invasive diagnostic methods. Non-invasive diagnostic methods include a serological diagnostic, urease breath test. Helicobacter pylori is identified using histological tests, culture, and urease tests. Invasive diagnostic methods include obtaining endoscopic samples. Treatment can be combined with ampicillin and clarithromycin with proton pump inhibitors such as omeprazole. Foods good for Helicobacter pylori include broccoli, cauliflower, cabbage, and Brussels sprout. It is also a good idea to take broccoli sprout, vitamin C, and probiotics. Thank you for listening to the presentation.